All right. So here's the usual heat map. When we looked at this 2 weeks ago, about 73% of the counties were in high transmission rate, so that's gone up to almost 79%. Substantial rate was about 13%. That's gone down. The moderate counties was 10%, and then the low transmission counties was 2.8%. So we've seen a jump in the overall number of counties that have high transmission, but the actual case rate is going down. When we looked at this 2 weeks ago, the 7-day moving average was up 16%. And while during the break, we peaked and then the case rate started dropping. So we're down 8.5% over the past week across the country with the case rate. Likewise, hospitalizations have been going down. When we reported this last time, it was also up 5%, but the deaths have gone down. Last time we reported, deaths were down 2.4% across the country, and now they're down 12.6%. There has been a lot of talk about the Omicron variant, and I chose this picture because it just shows the quick upswing in case rates that occur because of this variant. Looking at United States variant report, which was reported on November 27, 99% of our cases were the Delta variant. Over the weekend, since December the 1st, now we have 17 states in the union have detected the Omicron variant. Likewise, in Washington State, this was reported on November 20 that we were 100% Delta variant. Saturday, the DOH reported that there were 3 cases of the Omicron variant that were detected in Washington State. And they do have a pretty vigorous sequencing program in Washington State, so they'll keep a close eye on all the counties, and it's probably just a matter of time before it's in our community if it's not already in our community. But there's still a lot we don't know about Omicron. There are some reports of, a lot of people are having vaccine breakthrough, so the risk of reinfection seems to be higher. There also are reports of the fact that natural immunity may not be very protective against the Omicron variant. Some reports suggest that people have milder disease. And then there is also some suggestion that our current vaccines still may have a positive effect of decreasing the risk of severe illness, hospitalization, and death. But again, it's just very much a lot of unknowns. And over time, we will know more and more. And I'll certainly report to you and the community when we get more information. Before, when we were just dealing with Delta, we noticed that our reproductive rate was dropping and our case rates were dropping. And I believe when we talked last time, we said that people were forecasting that our case rates will continue to drop through January. We will just have to wait and see what the effect Omicron has on our case rate curve. But as of now, we've continued to see a downward trend in our state case rate curve. Likewise, we've had a downward trend in hospitalizations and a downward trend in deaths. In Walla Walla, as of yesterday, we were actually below the state average with our case rate curve. The state average was 120 and we were 115. And if you look at incomplete data, we were even lower than that. And our case ranking in the state has continued to drop. We're now 22nd out of 39 counties, which is good for us. Hospitalizations have dropped. They've been kind of hovering between 2 and 6 admissions on the census per day. And once again, almost all these, the majority of the cases are in unvaccinated people for the hospitalizations. Looking at vaccinations, we've continued to show steady improvement in our vaccine rate per total population. We're now, I believe, 12th in the state. And I believe there's only one other eastern county in the top 12, and that's Chelan County. And also, notable like counties like Pierce County are below us. So, we've done, I think we're just making steady improvement with our vaccination rate. And last week we had 8 clinics total, and we had a bit of a jump in our total doses. We had 1,600 doses given. The majority of these were boosters, but we've also had a lot of pediatric doses. So we've had a lot of success because of the hard work and expertise of our people. With regards to testing, the Southgate Testing Center does about 50 tests per day, and that seems to be pretty steady. I anticipate that might increase with increased awareness of the Omicron variant, but they're able to handle more capacity, so that's good. So, even if we're concerned about the Omicron virus, it still goes back to our basic strategy. Getting vaccinated decreases your risk of getting COVID, that's for sure. We'll learn more about the Omicron variant, but also getting vaccinated decreases your risk of passing it on to others. It decreases your risk of severe illness, hospitalization, and death. And we really want to encourage our community to continue to get boosters. That's going to be really helpful for keeping our case rates down and keeping people out of the hospital. And also reminding people to get flu vaccines.